are my med cards. And okay, so we're gonna first compare the physician's order with the MAR. Here we have Kathy meets, July 25th, 1968, July 25th, 1968, and VIN number is 987-987-654-654-321. So I can see here she's got an allergy for codeine, so we want to make sure that none of the medications we're giving her today have codeine in them. So first we have ibuprofen, 400 milligrams by mouth once daily. 400 milligrams by mouth once daily. And we have one time here, which is 9 o'clock. For furosemide, which is 20 milligrams by mouth twice daily. Furosemide, 20 mgs by mouth twice daily, and we have 2 times here. And then we have Timolol, 1 drop of 0.5% to the right eye twice daily. Timolol, 1 drop, 0.5% to the right eye twice daily, and we have 2 times here. So then we're gonna put the physician's order away, and we are going to get the medications out that we need. So first we needed ibuprofen. We're going to do a quick inspection of the bottle, make sure that the expiry date isn't expired. And then we're just going to review what this medication does. So it's an analgesic, an anti-inflammatory, and an antipyretic. It's used, its contradictions are GI ulcer, risk of bleeding, and hepatic disease. And we want to make sure the patient isn't pregnant or breastfeeding, and have precaution with older adults and people with cardiac disorders. So next we have furosemide, and we're going to inspect the bottle. The expiry date is good. So this medication comes in 40 mgs, so we want to make sure that we split the pill with this one. So what this medication does is it inhibits the reabsorption of sodium and chloride at the proximal and distal tubules and in the loop of Henel. Its uses is it's a diuretic used to treat edema. Its contradictions is electrolyte depletion, and some precautions are diabetes, dehydration, hypovolemia. So there we go. And then we have Timolol, 1 drop of 0.5 to the right eye twice daily. So Timolol is a beta-blocking agent that reduces the production of aqueous humor, causing pressure within the eye. This is used to reduce the risk of damage to the optic nerve and the loss of vision in patients with glaucoma. Some contradictions are hypersensitivity to beta blockers, asthma, and COPD. And then there's some precautions with pregnancy, breastfeeding, and people with diabetes mellitus. So now that we have the medications out, we're going to get them ready. I can wash my hands again because I'm going to be touching the medication. So first we're going to get out the ibuprofen. So we're making sure it's ibuprofen, 200 mgs. So we need 400, so we're going to have 2 pills by mouth once daily. So we're going to put 2 pills in here. Not going to put away the medication, we're just going to put it to the side. And we're going to write our drug card right away. Okay, so putting the patient's initials, we're going to put the drug, which is ibuprofen. We're going to put the dose, 400 mg. Volume, 2 tabs. We're going to not do anything for the dilute. Concentration is 200 milligrams per tab. Date is January 6th, and it is 9 a.m. And we have my signature, U-N-S-N-2-A-A. So we'll put that on here, and then we're going to put it on our tray. Okay. Then we have furosemide. So this is 400 or 40 milligrams. We only need 20 milligrams. So we're going to need a pill splitter for this medication. So this is by mouth, and it's given twice daily. So that in there, make sure it's all aligned. Perfect. Okay, so we can put that aside. And then we're going to make our label quickly. So CM, furosemide. We have dose 20 mg, volume 0.5 tab. Concentration is 40 mg tab. And the date is January 6th. And 9/8.
Do you guys have any of the 3-5 masks?
UMSN2K.
Yeah, I'm going to let you guys with I forgot to bring one. Do you have any of the caps? So that's
Okay. Then we have the Timolol. So that's 1 drop of 0.5% to the right eye. One Timolol, 0.5% to the right eye. And then the date, January 6th, 9 a.m.
But we made it.
So that's something that.
Okay. So we'll put that there. Okay, so now that I have my medications, I do just want to quickly compare the labels with the drugs. So we have ibuprofen, 400 mg by mouth daily, ibuprofen, 400 mg, 2 tabs by mouth daily. And then, so I just want to remind myself what are some effects that we could that the patient could have while taking this medication. This one could be nausea, diarrhea, and dizziness. So then we have, we can actually put that away now that we've done our second check on that. Then we have furosemide. So this is 20 mg by mouth twice daily. Furosemide, 20 mg by mouth daily. 40 tabs, so we split the tab in half. Or 40 mg, split the tab in half, so 20 mg. So I'm going to remind myself what are a couple adverse effects that I should look out for in the patient. We want to look out for headaches, orthostatic hypertension, and nausea. Lastly, we have Timolol. So Timolol, 1 drop, 0.5 to the right eye. Timolol, 0.5, 1 drop to the right eye. Everything is good, and a side effect we should watch out for is blurred vision, burning, or stinging in the eye. Okay, so I'm going to grab the stuff that I need. I need a glass of water. I need cotton ball, and I also need gloves. So.
We'll check blood pressure after we administer it.
Hello, Kathy. How are you doing this
We
morning?
want to check for cardiac failure.
You're doing good. That's great. I'm gonna just lift you up if that's all right. I've got your morning medications for you here. Before we start, can I just get you to tell me your birthday?
And yeah, so we're gonna
Okay. And I'm gonna check it with your wristband here.
Close our eyes for 5 minutes.
So Kathy means July 25th, 1960, July 25th, 1960, and 987-654-321, 987-654-321. Good, and I see here you have an allergy to codeine. Is there anything else that you might have an allergy to? Oh, okay, good. So, as I'm getting my stuff ready, I'm checking to make sure that the floor is clean, that doing my safety checks on the patient, the rails. So, I'm going to lift you up just a little bit as well, so I don't hurt my back. Okay, so my name is Katherine Kwartel. I'll be your student nurse today. I have 3 different medications I'm going to give you. And I'm just going to quickly make sure my medication, make sure I have everything with me. So we have ibuprofen by mouth once daily, ibuprofen by mouth, 400 mg by mouth daily. Then we have the furosemide, 200 or 20 mg by mouth twice daily, furosemide 20 mg, Protect by mouth daily. And then we have Timarol, 1 drop, 0.5 to the right eye, twice daily. Perfect, I have everything here. So before I give you your medications, there's a couple of things I'm going to assess. I want to assess your vital signs to make sure you don't have a fever. I also want to, if we're using this as fever medication, the ibuprofen, I also want to do a pain assessment. So I've done that. The pain is rated at a 6. So, do you have any questions before I give you this medication? No? Okay. Here you go. Did that go down all right? Good. So, with that medication, I'm just going to let you know that you could have headaches, dizziness, nausea, or diarrhea with it. If you have any of those symptoms, please let me know. I'm going to be back in an hour to monitor your pain and check for a fever again. And if you're taking this medication at home, you should not ever exceed 1,200 milligrams per 24 hours. Okay, so the next medication I'm going to give you is your furosemide. Have you taken this medication before now? Oh, you have? Okay, good. So this is for the edema you're experiencing in your leg. So before giving this medication, I want to assess the patient's weight, their ins and outs, their blood pressure, temperature, and their electrolyte balance. So I've done that already. I'm going to give the patient their medication. Need some help? Okay. Did that go down all right? Good. So the last medication I'm going to give you is your Timarol, and that is for the glaucoma you're experiencing in your right eye. So some adverse effects of this medication are blurred vision, burning, and stinging. So please let me know if you have any of those symptoms. So first I'm going to put on my gloves. As I'm going to teach you how to use this medication at home. So first you're going to pull back your lacrymal duct, or your duct. No. We're gonna pull back the shoot, I forget what it's called. So what we're going to do is we're just gonna pull back the bottom of your eye a little bit, exposing your sac, the bottom eye sac, and then you're gonna look up. Okay, I'm gonna drop one drop into there, and I'm gonna grab, or you're gonna want to grab a cotton ball and put pressure on your lacrymal duct for 2 minutes. Is that enough pressure? Okay, and after 2 minutes, you can just wipe off the excess there. And it's very important that you hold that pressure on your eye for 2 minutes because this drug can go systemic, and we want it to just stay in your eye. So, I'm gonna want to come in and assess the therapeutic response of that medication within an hour. I'll be back to do all my assessments to reassess you again. Okay, so I'm gonna leave you in that position, but I'm gonna put you closer to the ground. I'm gonna do a check and make sure I cleaned up my stuff, but also make sure it's a safety check around the room. And then I'm gonna go and I'm gonna grab their call bell and put it right close to them. Okay. And I'm gonna wash my hands as I leave. Okay, throw those in the garbage. Is there anything else that you need? No? Okay. Please let me know if you need anything. Oh my God, I can't believe I forgot that. So before I leave the room, I'm just gonna quickly document that I gave the medication at 9. It's 9:15 now. 9:15. Okay.